I am Dr. Hemant Kalyan, consultant and head of the Department of Orthopaedics and Sports Medicine, working at Manipal Hospital, Bangalore. After an injury to the knee, which happens, say, on the sports field, the very important thing to do is to stop playing after that. A lot of people unfortunately underestimate the true extent of their injury, especially while playing. In the heat of the game, they may feel that they can continue to play, and in doing so, they may actually aggravate the knee injury. So the first thing that happens if you're playing a sport and you get injured, even if you're playing just in your own local club, come off the field or come off the court, have a physiotherapist or at least a neighboring person look at it. If there is a knee swelling or if the knee looks abnormally shaped, please don't continue playing. So the first thing is to discontinue the activity just after the injury has happened. Apart from this, there is a very useful preventive strategy or early treatment strategy for knee injuries, and that is known as RICE. R-I-C-E. R stands for rest to the part, which I already mentioned. So don't continue the activity, rest the part. Second is I for ice. A lot of people get confused, when do I put ice, when do I put heat? So in a knee injury, the rule of thumb is, if you don't know what the injury is, you put ice and you can't go wrong. The reason for that is that ice will prevent further swelling from happening. It will help the redness and the warmth around the knee to decrease, and it will also produce a good pain relieving effect. The next of RICE is C. C stands for compression. So compression is basically a technique used to prevent the knee swelling from getting worse. So the easiest way to do it is to get a crepe bandage, which is the pink elasticated bandage available at all neighboring chemist stores, and apply the crepe bandage on the knee. Remember to apply it starting from the toe end or the foot end and come up towards the thigh end. Don't go in the reverse direction. This will help to control the swelling. And the final one is a E. E stands for elevation. Elevation simply means that the foot should be above the level of the hip. So basically, if you are sitting in a chair, then keep a footstool, 1 or 2 pillows on top of the footstool, and the foot should be higher than the level of the hip. Alternatively, if you are lying in a bed or on a couch, then ask one of the family members or friends to get 2 pillows and keep the pillow underneath the foot end so that the foot is higher than the level of the hip. So the reason for this elevation is to prevent the swelling from getting worse. A word of caution: don't self-medicate yourself with too many pain medications just bought away without prescription from the doctor, because some pain medications can produce harmful side effects, and as a non-medical person you may not know this. So stick to simple pain medications like paracetamol, which will give a good relief of pain, and the RICE technique that we just spoke about.